Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. Today, we focus on an important medical condition that affects millions of men worldwide. Today, we'll be discussing prostate cancer, a condition that affects male reproductive system and is one of the most common cancers in men. Joining us to explore the medical perspective of this disease is Asiegbu Jumbo Emmanuel, a seasoned cardiothoracic nurse with vast experience in surgical care and patient management, who joins us virtually from Abia State. But before then, let's give you some of the health updates for this week. Stick around.
According to the World Health Organization, rotavirus-associated diarrheal diseases account for approximately 215,000 child deaths annually, particularly in low-income countries such as Guinea, Chad, Somalia, and South Sudan. In addressing this, Nigeria is sharing its experiences in achieving sustainable financing for nationwide immunization programs with neighboring countries in West Africa.
But what we're saying today is, how do we support government efforts? That is why we're here today. That is what this workshop is about. So CSOs, we have been recognized. In the full portfolio planning of MPACD, the role of CSOs were itemized.
During the peer learning meeting in Abuja, Chika Ofo, Chief Executive Officer of the Vaccine Network for Disease Control, encouraged African countries to build on the positive outcomes of vaccine introduction while avoiding the missteps experienced in other countries.
When it comes to vaccine introduction, there's some things that are clear. Trust is at the key of vaccine introduction. And there's so many other, the social behavioral change. How do you share the message, the messenger, the content, the outcome? These are literally, it's very scientific that these things have to be done properly, appropriately. Everybody is important just to make sure that people receive the vaccines that they need. Trust. You do know the funny thing about vaccine? It is like taking medicine when you're not sick. So people need to trust that what you're doing is correct. And then you use the people that they trust. And then using the avenues that they trust. These are the things. And then making sure that you are as truthful as possible.
The delegation revealed that despite the availability of highly effective vaccines, diseases like meningitis and diarrhea continue to be leading causes of child mortality in Guinea.
The purpose of their visit is to engage with Nigerian partners to develop advocacy strategies for introducing the PCV and rotavirus vaccine in Guinea. Abdullahi highlighted that meningitis and diarrhea are major causes of child mortality in Guinea. Despite the availability of highly effective vaccine, Guinea is one of the few countries that has not yet included PCV and rotavirus vaccine in its routine immunization schedule.
Others, including former Nigerian Parliament member and Deputy Chair of the House Committee on Healthcare, believe that regional collaboration could significantly improve vaccination rates and child health outcomes across the region.
That the introduction of these vaccines should be seen as more than a stopgap measure, because it represents a broader opportunity to strengthen health systems in both Guinea and South Sudan.
Vaccines are, to a certain extent, expensive, and they require finances to be able to have them. You either purchase them or you manufacture them, and that requires support of everybody, including the legislature.
According to the delegation, the goal is to develop a comprehensive civil society organization strategy that can be adapted and tailored to meet the needs of Guinea and South Sudan in rolling out these vaccines.
Thank you for joining us today, Asiegbu Jumbo Emmanuel. Thank you for your time and for always listening to our calls. Can you hear me?
Yeah, I can hear you. Thank you so much.
Thank you for always obliging. So today we're talking about prostate cancer, which we know is one of the most common cancer in men. Could you please take us through what this means by giving us a brief, description of what it is?
Okay, prostate cancer. Before we dive into prostate cancer, it's very important for us to understand what this prostate is all about. Here, we said that prostate is a small walnut-sized gland that is located below the bladder in men. its major function is to produce seminal fluid, which is there to nourish and to transport the sperm. Now, we'll now look at what prostate cancer is all about. This is an abnormal cell that grows in the prostate. You understand? So it grows uncontrollably, meaning that you cannot control its growth. So that's the major issue about this prostate cancer.
Okay, but how does this cancer come about? Because we know that cancer is not something that people can just contract just like that. So how does this happen? What are the risk factors? What puts people in that place where they can just, be at risk of prostate?
Okay, talking about the risk factors of prostate cancer, there are several risk factors. Number one is age. You look at men above the age of 50 are highly prone to having this prostate cancer. Research has proven that 60% of men above the age of 50 are likely to have this prostate cancer. Other risk factors are family history, that's coming from genetic lineage. Then other factors can be the diet. Men who consume high amounts of fats such as red meat, they are also prone to having this prostate cancer. Hormonal imbalance for men who have high amount of testosterone or that's the men hormone, are also prone to having this prostate cancer. Other issues are lifestyle. Lifestyle include excessive intake of alcohol. Men who do smoke are also at risk of having this prostate cancer. You can also say that that's our African country are mostly prone to having prostate cancer.
Why did you say African countries are mostly prone to having it? Why?
Because of our genetic inbuilt, unlike the white. You understand? Due to our environment, the kind of things we face here, you understand? That is why Africans are really prone to having this prostate cancer.
You described prostate itself earlier. What role does it play in a man's body?
Okay, the major role of this prostate is to secrete what we call the seminal fluid. Now, this fluid, its main function is to nourish and to transport the sperm that is being produced by the men.
Okay. So at what stage can prostate be detected in a man's body? Like what stage, how early should it be detected, or how should one, take note of prostate cancer?
Okay, it can be detected at early stage. That is why we encourage men above the age of 50 to always go for screening to visit their doctor, so that a proper examination can be done to checkmate their body system if they are at risk of having this prostate cancer. So it can be checked, it can be seen at early stage.
And what are some of the symptoms to look out for? Because at least if you have to check something, there has to be some specific symptoms that you have to begin to look out for. So you know that, once I see this sign or this sign, then I think there is something wrong and I have to quickly go for a check. And we all know that when it comes to cancer, early detection is key to resolving it. So what are the signs and symptoms to begin to look out for when it comes to prostate cancer?
Okay, some of the signs, although prostate cancer, we say that it is asymptomatic, meaning that most times it does not come with signs. That's early signs we are expected to see. But some of the signs we can see are difficult in urination. Notice that men feel difficult in urination. Sometimes we can also see there's a blood in urine We can also see blood in semen. Other signs and symptoms could be erectile dysfunction, whereby this man can't function properly as a man. Then other signs could also be that's lower back pain. These are some of the signs and symptoms that can actually be seen. Although this prostate cancer, the signs and symptoms are not always there. They are not always there. So these signs might come later at the late stage of prostate cancer. So that is why we advise men to always go for checkup and screening early enough.
There was also something you mentioned, which was about the fact that genetics has a role to play. How does that even happen? So which means that if a family member probably has prostates, it is very possible, and there's a high chance that other people in the family could also be at risk of it, right?
Yes, of course. I made mention of that. Now, this genetic factor, it goes in lineage. It's just like you noticing that, okay, you have the same structure with your dad or mom, you have these same eyebrow, same lips. So this thing goes through genetic pathways during birth. You understand? It will not manifest at that early stage of birth, but it will manifest later in life. You understand? So it goes through, it comes later in life. So that is why we made mention that this prostate cancer comes through family history. Now, it is not a must that the individual father must have that of prostate cancer, but if there is a trace of cancer, you understand, in the person's lineage, it can also lead to prostate cancer for that individual.
All right, so let's try to connect this to your profession as a cardiothoracic nurse. So how do you handle a patient who has prostate cancer and probably an underlying health challenge? I mean, heart issue.
Okay, for any patient that has prostate cancer and any cardiothoracic issue, we handle this issue very delicate because one thing with prostate cancer is that it spreads. That's one major factor about this prostate cancer. And once it starts to spread, it also affects the heart. So whereby we start treatment on time, it is very important and vital to start treatment on time. So there are so many treatments that is good for this prostate cancer in order for it not to affect the heart deeply or to shut down the heart, which will result to death of the individual.
So prostate cancer can actually be deadly.
Of course, if not treated early enough, it could result to death.
Wow. Because it's really becoming scary. So there's this notion that people have that I want you to either affirm or refute, which is the fact that people think that men who have been sexually active all their life and become sexually inactive at the later years of their life are at risk of prostate. How true is that?
From my end, I would say it's not true, or it has not been proven. You understand? It's not true. So we particularly believe that some doctors actually believe that men who are sexually active are somehow not prone to having this prostate cancer, in the sense that because they excrete and they remove that's the semen and sperm, therefore some other toxins can also follow out from the prostate to go out, so making them free from having this prostate cancer. So that is what some doctors or some health practitioners believe, that ejaculation and the release of semen and sperm can also reduce the chances of the individual having this prostate cancer.
Okay, so that's almost similar to the fact that when a man is sexually active, is at lesser risk of this cancer, but when he becomes sexually inactive, it means that he can be prone to it. Will that be correct?
Of course.
Because that's the story that people sell on the streets. Like, you can have prostate cancer if you become sexually inactive. So you have to stay sexually active, especially at the older age. You know, that's the story that people sell. So what about, how do we go about the treatment of prostate? Because first of all, you have been able to detect it. Is it curable? That's the first question.
Of course, it's curable if detected early enough. So in terms of treatment,
please go ahead.
Okay, in terms of treatment of this prostate cancer, we have several treatment methods we use. Number one is that of the surgery. That's the example is that of the surgery, that is prostatectomy, whereby the surgeon remove the prostate entirely. This type of surgery is done at the later age, whereby this prostate has spread enough. You understand? So the right thing to do is to remove the prostate entirely. Now, other treatment medium is that of hormone
therapy.
But
sorry to cut you, if they take off the prostate entirely, does it not somehow affect the health of the man in question?
Okay, it does not affect the health of this man. Rather, is when you check the risk. You understand? When you check if this cancer is there, it's going to spread and it's going to affect other organs of the body. So it's better to remove it. And at this age, you will notice that most men have given birth, so there's no need to worry. You understand? Most men at the age of 50, some have completed giving birth, so there's no need. It's absolutely good to remove it at this stage, because if you leave it, it's not only going to damage other organs, but other tissues too, but it's also going to put this person's life at risk.
But once you take it out, does it stop sexual activity?
Of course, because the main purpose of this prostate is to release what we call the semen. Now, this semen helps to nourish the sperm and also to transport it. So it also affects the rate at which this person gives birth. So it is very difficult for this person to give birth after removing it.
So are there specific concerns when managing maybe specific patients who have these cardiovascular issues? Are there specific concerns when you're treating them, those patients?
There are no specific. The major thing is to make sure that this person, if the person is having cardiovascular issue in relation to prostate cancer, you understand, we tackle that of the prostate cancer together with the cardiovascular issue. The main purpose is to make sure that this individual is healthy and comes back fit enough.
Okay, but are there stages to this prostate cancer? Are there stages where people can get to maybe first stage, second stage, maybe some sort of acute stage, or some sort of stages that are not very acute?
Okay, yes, there are different stages when it comes to prostate cancer. We have 4 major stages. We have stage 1, stage 2, and down to stage 4. When it comes to stage 1, at this stage, there is presence of this abnormal cell in the prostate. So at this stage, no sign or symptom is being seen. No sign or symptom is being seen. Then in stage 2, now this cell that is inside the prostate, this abnormal cell that is inside the prostate begin to enlarge. It is still under the circle of the prostate. It has not gone out of the prostate. Now, at the 3rd stage, it begins to affect other surrounding tissues around the prostate. At this stage, this individual can likely be seeing symptoms which are like difficult in urination, blood in urine, or semen. Now, at the 4th stage, which is the final stage, whereby this prostate is now fully blown, which can affect other major organs. It can also affect bones too. So at this stage, it is now resulting to erectile dysfunction, and other signs and symptoms can also follow at this stage.
That means it's really a complex one if it's not properly taken care of.
Of course, that is why we encourage early detection and regular screening.
But People tend to be a bit quiet about it. You know, there's something about anything that has to do with women. There's so much awareness compared to anything that has to do with men. There's zero or little awareness. You barely even find people talk about it. You barely find people come out and, you know, share their problems when they have it. Having been relating with some of your patients, what do you think is the biggest challenge as to how to express themselves when they have this challenge? But I don't want you to respond to that question yet. Let's go on a quick break. When we return, then we can have the question. Stay with us, everybody.
Until now, the National Emergency Medical Treatment System has been operational in 16 states. These retreats became necessary to address the gaps and challenges in the country's emergency response services, particularly in maternal and child health care. The meeting was chaired by Dr. Ismaila Musa Jibri, chairman of the National Emergency Medical Treatment Committee, who emphasized the need to improve emergency response, especially in rural areas, to reduce the country's high maternal and child mortality rates.
This is a very important link that was missing in our healthcare system. We took care of the primary, the secondary, and the tertiary sectors, as well as our educational areas. However, the response to emergencies is what is missing, and this is what we're here to address today. We're going to discuss how to roll out this important piece of service across the country and to reach even the rural areas. We will be targeting especially maternal and child emergency conditions so as to reduce our dismal mortality rates among the women as well as among children. Thank you.
The National Program Manager, National Emergency Medical Services and Ambulance System, Dr. Saidu Ahmed Dubulwa, disclosed that Yobe State alone has saved over 1,000 lives since the introduction of emergency service system. He encouraged more awareness about the emergency toll-free number 112.
And honestly, I was excited when you have seen the presentation made by Yobe State government. Yobe State, you see the number of lives so far they have seen. Almost 1,000 lives were saved, you understand, with a minimum of only 1.5% mortality recorded, which is a very significant effort that can be that will change the narrative as a whole. Imagine now all 36 states are actually operational, working, and every year they are saving within a year 1,000 lives. So how many lives are we going to save?
Also, the co-chairman of the committee, Professor Seifa Brisibi, gave more details of the emergency response plans, while the representative of the World Health Organization urged for more commitments for such services like this.
This process, we are going to strengthen our referral systems as very, very well. That is one benefit that this is going to give to this country. In this case, there are cases where a pregnant woman goes to a hospital or a primary healthcare center. She is referred to a secondary because there is no structured transportation system. The next thing you see this pregnant woman divert to probably an untrained TBA and we have complications. So this is also going to strengthen and create a very robust referral system in our country.
The National Emergency Medical Treatment Committee has a statutorily allocated budget through the Basic Healthcare Provision Fund, which provides 5% of the fund to run the operations. The committee says it is working closely with partners like the World Health Organization and the World Bank to secure additional resources for the expansion.
Lassa fever remains a serious public health threat in West Africa, with Nigeria bearing the highest burden. In recent years, outbreaks have become more frequent due to climate change, highlighting the urgent need for better preventive measures, including the development of a vaccine. In response, the Coalition for Epidemic Preparedness Innovations, together with the governments of Nigeria, Liberia, and Sierra Leone, has launched the Enable 1.5 study, which aims to build on the findings and address gaps identified in the 1.0 study. The project coordinator in Nigeria, Elsie Ilori, explained that the goal of Enable 1.5 is to support the development of an effective Lassa fever vaccine that can protect against the various strains of the virus found in Nigeria and across West Africa.
For Lassa fever, just like some other diseases, we have symptoms fever, which is also common for malaria, for all other infectious diseases. So we want to be able to identify co-infection in Lassa fever, and that's using the malaria as a kind of as the point. The main purpose actually is for clinical studies to be able to produce vaccine towards Lassa fever disease, trying to make sure that we reduce the burden of Lassa fever in the country and West Africa in general.
One of the key focus areas of the new study is to examine Lassa fever in children aged 0 to 2 years, a group that was not included in the earlier research. The project manager of the Coalition for Epidemic Preparedness Innovations, Royce Fulton, outlined the organization's plans to develop a Lassa fever vaccine by the end of this decade.
We realize that it's not just important to try and have vaccines developed through clinical trials, but to do the additional groundwork necessary in order to be able to identify where the disease is, what sort of folks have the disease, where can we find places that we could recruit and use subjects for these clinical trials. But on top of that, build the necessary capacities within the countries and within our partners in Nigeria and other countries in order to be able to really prepare for the great work that lies ahead, which is to have clinical trials at a large scale that allow us to identify just how effective a new vaccine will be, with the ambition of having that vaccine ready by 2030 here in Nigeria.
The study is expected to investigate the co-occurrence of Lassa fever and malaria while assessing the ability to manage these cases effectively.
For the 4 sites in Nigeria, we'll be able to start the phase 2B trial of the Lassa vaccine candidates, and that would take a year. So immediately after that, and then after the analysis has been done, we'll now commence the phase 3 clinical trial. So the phase 3 clinical trial would take at least a minimum of a year or 2. So I would say that for the vaccine to be ready, we have to conclude the phase 3 clinical trial.
The gap identified in Enable 1.0, we are coming up with Enable 1.5 to be able to make sure all the challenges we envisage in the center or generally are covered, so that we'll be able to launch the vaccine, because there's already a candidate vaccine for Lassa fever.
The study will be conducted in 3 countries, Nigeria, Sierra Leone, and Liberia, with 5 sites selected based on the high burden of Lassa fever cases.
Viewers, we're still discussing prostate cancer with Asiegbu Jumbo Emmanuel, a cardiothoracic nurse, who's giving us insights on what prostate really is and how best to take care of it if you have prostate cancer already. All right, so I was asking you a question earlier. I said when it comes to anything related to women, there's usually a huge awareness around it, and women are able to come out and express themselves and tell their situations. But when it comes to men, it tends to feel like it's zero awareness, very little to zero awareness. And then most of these men tend not to be able to really come out to express themselves, especially when it comes to early detection. Now, that's why we find that there are usually a lot of death when it comes to prostate cancer. So having related with a few patients, what has been your experience as to the reason why some of them don't come out to express themselves, especially when it comes to these issues?
Okay, when it comes to most of my patients, after relating to them, especially the male genders, that's the men, they mostly believe that when it comes to sickness, they believe that they can handle it on their own. They believe that they have 1 or 2 they will take that will flush things out, which is not actually like that. You understand? So when it comes to prostate cancer, it's not about what you take to flush it out. Some believe that once they miss 1 or 2 things, that they are already fine, and even while they are in pain due to our nature.
Isn't that what we do as Africans? We always want to think of alternative medications.
Yes. So even when maybe they feel pain and all those things, they'll feel maybe it's from so person is attacking them and all those things. They feel maybe it's spiritual instead of visiting the hospital. So these are some things that men do. You understand? And because they are not unlike women who likely visit the hospital either because of childbirth, and you notice during that period they go for antenatal and other things. So during this period, the nurse or the health practitioner can also educate them on other areas, unlike the men that does not visit the hospital apart from when they have a severe case. Where if you notice, it is during that period that they will conduct a test and scan, and they will now notice that, see, something else is wrong with you apart from what you came for. So it is majorly all these things that happen.
Now, you talked about a couple of treatment options, and you also talked about surgery. Does chemotherapy, does it work in this case?
Of course, I only mentioned surgery, that's prostate. We have other ones, which is chemotherapy. We also have radiotherapy. This involves using radiation, type of radiation you use, either to dry up that abnormal cell, or you also use it to kill that abnormal cell in the prostate. Now, other means hormone therapy. Now, remember I made mention that high hormone, that is the men hormone, can actually result to this prostate cancer. So hormonal therapy, whereby a medication is given to reduce the level of that androgen, the testosterone in the men's body. So these are some of the treatment options that can be given.
Okay, so what's the post-recovery phase like when it comes to prostate cancer surgery? What's the post-recovery phase like? Is this something that helps them eventually get back to their normal lives, or do you also do some sort of awareness and sensitization with them, especially when it comes to their mental health? Because a lot of them probably feel like they're no longer men, and especially when they are no longer sexually active. They won't be sexually active, right?
Of course.
So when they are no longer able to, do their responsibilities. So how do you help them navigate through this phase when it comes to the post-recovery stage of prostate cancer?
Okay, at this post-recovery stage, it's not just involving only them. At this stage, it involves also their family member, especially the person's wife. You understand? So at this stage, you help educate all of them. Now, trying to tell them that, see, it's of the benefit that this organ, this prostate has been removed, because as much as there is life, there is still hope to acquire or do other things. You understand? So you, first of all, educate this person, giving the person hope that, thank God that you are alive, because most persons has this illness, which is the prostate cancer, and they are not longer alive. So it's of the person's good that actually is also alive. You understand? So we also educate them on other sexual activities. You understand? Trying to tell them that they can go ahead with their daily activities. This does not affect their other activities. So we base more on health, educating this individual and also the family members too.
Okay, so are there possible complications that can come up from some of these surgeries? And how do you specifically handle patients with delicate heart issues when you have to, when they have to undergo a surgery or chemotherapy or radiotherapy, as you described?
Okay. One of the specific things we look into when it comes to prostate cancer, when handling them, maybe after the surgery case, is to ensure that the aseptic technique was really maintained during the stage of, during this period of surgery, making sure that this person is not put in place to any type of infection that can also trigger the heart too. Because if there is infection, it will also reduce the activities of the heart and also reduce the immune system. That is when it comes to prostate cancer treatment. And also we encourage at this stage too, we also encourage this person to boost his or her immune system by taking more fruits and vegetable. We also educate this person to reduce intake of high fat. The person should take more of omega-3 fatty acid, which is seen in fish. So we instruct this person to take more of this fish, all these things I've mentioned, because they also help to boost the immunity and also to keep the heart working, actually.
Patients, and you talked about the family support and all of that. So how do you also are you also responsible for educating the family members on how best to handle them going forward and help them get back to their normal lives?
Of course, I'm also, as a health worker, after the surgery or after this case, or if the man is still under treatment, it is also the responsibility of the health worker to also educate the family members, because most of them tend to segregate. They say, most of them don't really understand what prostate cancer is. Most of them feel that it is something contagious. You understand? So you be the one to get them, telling them that this is not contagious. It's not something that is contagious. Rather, is something that requires the family support, the healthcare team, to make sure that this person comes back fit enough and healthy enough. So you educate them to stick by this person throughout the period of recovery of this individual.
So there are actually a lot of misconceptions around prostate cancer that I wanted you to address. And the first one I thought is about the fact that prostate cancer always leads to impotence. How true is that?
Impotent, is actually, it causes infertility. You understand? If not detected on time, you understand? This prostate cancer causes infertility in men, making them not to be functional as men. So it's actually quite correct.
So what about the assertion that it's only found in older men? Is that true as well?
Yes, it's only found in men who are above 50 years.
Okay. And what about the notion that it grows very slowly? The cancer grows very slowly. How true?
Absolutely very true. Because I made mention that early detection is very crucial when it comes to prostate cancer. Most men does not really know that they have it unless they are booked for a visitation in the hospital. That is when it's being detected. So it's been advised that once you are at the age of 50 and above, start going for screening and checkup.
Okay. And they also say that it also causes some level of, it gives men a bit of, what's the word again? Low self-esteem, especially knowing what they're going through.
Of course, knowing that you are not longer active as before, and it makes you feel that you are no longer a man that you used to be. So it's actually correct. So these are some of the things we handle during the health education. We also educate the men so that they won't feel more low of self-esteem.
Okay, but does the symptom always show? Like, are there cases where there could be some persons could be asymptomatic, or are the symptoms always obvious?
No, the symptoms, just like I mentioned before, the symptoms are not that obvious. It comes gradually, and it is towards the late stage when it has blown to full-blown cancer, prostate cancer. That is when you start seeing this erectile dysfunction, you start seeing blood in urine, you start seeing fecal incontinence, that's difficulty in passing out to. A lot of things now start manifesting at the late stage. So at this late stage now, the major treatment could result to prostatectomy, whereby the prostate is being removed, or any other treatment too can follow.
All right. So what are some of the preventive measures that we can take as take home today? What are some of the things that people need to do, maybe lifestyle changes, or the preventive measures that we need to put in place?
Okay, there are several preventive measures when it comes to prostate cancer. One of them is screening. Once you are above the age of 50, you don't need someone to come and tap you and say, start going to hospital for checkup. You need to go to the hospital for checkup. Also, another preventive method is reducing intake of excessive alcohol and smoking, because they can also lead to this prostate cancer. We also educate men to eat healthy food that are low in fat. Food that are low in fat, reduction in red meat intake. They can take omega-3 fatty acid, which is seen in fish, take more of tomatoes, take more of fruits and vegetables. This helps to boost up the immune system and to prevent prostate cancer. So reduction in weight. People who are obese, they should try to reduce their weight, keep fit, do exercise in order to keep their body fit. All these things helps to reduce the risk of prostate cancer.
Okay, beautiful. So are there at what age precisely can men begin screening for early detection?
From the age of 50, it is being advised that men should start checkup or screening for this prostate cancer.
And how often should the screening go in a year? Because maybe most of the time, if you check today, it might not be there. You know, for HIV, you need about 6 months window. Even if you check now, you have to check again in 6 months' time. But for prostate now, how often should this screening be? From time to time, how many times a year? How often should it be checked?
You can check every 3 months or 6 months. Every 3 months or 6 months.
Okay. And can they just walk into any hospital and, you know, get the screening? Is it just at any hospital? And how expensive can the screening be, or are there free opportunities?
There are free opportunities in some states. In some states, that of the price of the screening, it depends on, because we have several screening tests for prostate cancer. We have that of the PSA, which is the prostate specific test antigen, which is being done for this individual. We have a digital rectal examination, which is also being done. We have biopsy. So it depends on the type of examination you want to do. So they will tell you the price. Most of them are expensive, you understand, when it comes to the nature of our environment and country. Some of them are expensive, while some are not expensive.
All right, thank you very much. I'll let you give our viewers your final words today before we wrap up.
Okay. I would like to say that prostate cancer is not a death sentence if detected early. And I want to encourage every one of you out there to stick to regular checkup. I encourage everyone to take more of a healthy lifestyle. Is very important. This will help to reduce the rate of prostate cancer. I want you to remember that your health is in your hands, and stay informed and stay healthy. Thank you.
Thank you very much, Asiegbu Jumbo Emmanuel, for giving us this deep insight into prostate cancer, especially from the angle of a nurse and a caregiver. Thank you so much. We really do appreciate you today.
Thank you so much.
All right, viewers, that's it on today's episode of Healthy Living. I hope you've taken 1 or 2 lessons. Early detection is key. You must take care of your health. And talk to a man around you. Make sure you look out for a man. Men would probably never look out for themselves. But remember to look out for a man if you're a woman out there. Thank you so much. I'll see you again next week. I am Olamide Alhassan. Bye for now.